Hello, this is Anna Laura Brown, host of the Autoimmune Rehab Podcast, where we talk about how to actually thrive and heal your autoimmune condition rather than just covering it up with pills or changing your diet and hope you'll feel better one day. We feature solo episodes on helpful topics and interviews with guests who have actually walked in your shoes with autoimmune disorders and/or who have years of experience in helping people to thrive and not just survive with autoimmune challenges. I'm a health coach who started this podcast because I was diagnosed with Hashimoto's in 2018 and wanted to inspire hope and transform health for people with autoimmune conditions. So keep listening and let's get you the help and hope you really need. This is the Autoimmune Rehab Podcast. And today I am really excited to welcome to the podcast Dr. Suzanne Ferree. I'm hopefully saying your name correctly. If I'm getting it wrong, go ahead and
Sure.
correct me. And along with that, why don't you start off by giving us a little bit of an introduction about who you are and why you are here?
Thank you so much, Anna Laura. I'm excited to be here. So I'm a doctor in Atlanta, and I started out I've been treating patients with Hashimoto or MS or lupus for many, many years. And as time went on and progressed, certainly that diagnosis for those patients evolved, and what I did to treat them evolved. Because initially it was just, oh, we give you steroids, here's your treatment, or here's your thyroid pills, see you later. And that was what I came from. And then as patients started demanding more, and I started realizing there were patients that were sick that were not showing up on the normal labs that I'd been trained in allopathic school how to do. Allopathic is just regular, go into your family doctor. And so I started to do some more investigation to figure out what else was out there because of that, and ended up going to several conferences and getting some more education. I went back and got a fellowship training in functional medicine. And so that's what I practice now. I have a concierge practice in functional medicine, and we do treat lots of autoimmune patients in that practice. I have two nurse practitioners who are amazing who work with me, and a dietitian, and has been really a blessing to work together for now almost 20 years.
That's awesome. That's great. And kudos to you because, like you said, I mean, a lot of doctors just kind of, for whatever reason, they don't realize that they're doing their patients a big disservice. They're really not helping anybody by just giving them an autoimmune diagnosis, if they even get a diagnosis in the first place, which is a whole nother issue in and of itself, and then just throwing pills at them and saying, good luck, hope you get better. It's like, yeah, no, that's not going to happen.
Exactly. And none of us want to be the person that has the autoimmune disease, because it means you have to do things differently than everybody else. You have to make sleep a priority. You have to eat properly. You have to pay attention when you get sick from other things. There's just an elevated level of awareness that needs to be present when you have an illness like this, so that you can keep this from giving you any trouble. It just means that your genetics are such a variant, and that, or your exposures were such a variant, that you need to have a higher level of vigilance than the average person.
Oh yeah, absolutely. Yeah. And anybody that's listened to any of the other episodes knows that there's lots of different reasons why people get autoimmune conditions. For every person that has the same diagnosis, there could be 20 different stories or theories about how the person got it. And so, yeah, but the one thing we do all share in common is that, yeah, you have to be really vigilant, say that word correctly. And yeah, like you said, just work with a doctor like yourself that is actually into the functional medicine and is into actually really helping you truly heal and making those lifestyle changes, because otherwise you're just going to be sick forever if you don't do that. That's just the reality of having an autoimmune condition. So let's get in a
Or
little
a
bit
really good
now.
health,
What was that?
or a really good health coach.
Yep, more health coach too. Health coaches can be helpful too. Lots of different people out there that can help out with stuff, but at the end of the day, Yes, but at the end of the day, most people aren't going to be able to just fix their autoimmunity or whatever, that means, whatever terminology you want to use on their own. So now let's start talking about, I know you have just written a book on peptides. So let's talk about that. I scanned through the book, but truthfully did not read the entire book yet, but I'm sure I will eventually. And I was really intrigued by, what I did read. And I know peptides are something that I've heard about, but it's not something that I'm sitting here going, okay, I'm an expert in this. I know a lot about peptides. And I would imagine that most people listening to this are also going to be in that same kind of camp. So, what would you describe exactly? What are peptides? Let's put it that way. For people that have never
Sure.
heard of them, what would you say they are?
So peptides are naturally made by all of our bodies. Our bodies make them all the time to make them do all the jobs that they do. So think about peptides sort of like the general contractor on building your house. And the peptides go in and tell the cells what to do. And then all the different parts of the body, the immune system, et cetera, will then go and do whatever the contract tells them to do. So like the plumber and the framer and the painter, all those different, and the peptides will tell life. And if think of a protein, we by convention call a protein anything greater than 150 amino acids in length. And a peptide is anything that's under 50 amino acids in length. So they're just really small proteins that can go around in our body do things. The most famous one that everyone's familiar with is insulin. So that's the probably the most familiar one. The pharmaceutical companies have picked up on a few of these. The most famous one that's out there right now is semaglutide or Ozempic for weight loss or diabetes. And I would propose that that is one of my armamentarium for treating autoimmune disease in some patients. But there are lots of other peptides that are out there that are available that specifically work on the immune system. There are two that are specifically involved in helping your thymus gland to function optimally. So that's what we want with our immune system, especially if we're dealing with an immune system that is busy making things that are attacking our cells, which is the situation with autoimmune disease.
Oh yeah, absolutely. Yeah. So let's get into that a little bit then too. So now that we kind of, we have a pretty good idea of what peptides are, how exactly, would somebody get peptides? Like what, somebody comes to a professional like yourself, are there peptides that people can buy as a supplement? I mean, exactly how does that work when it comes to actually obtaining the peptides?
Sure. So there's a couple of companies that make oral peptides, and there's one company called Healthgevity that makes BPC-157. This is a peptide that is available orally. It is naturally made in your stomach. It is protective against ulcerations, against damage to the stomach or intestinal lining, and it's part of my baseline treatment for a lot of my patients who have intestinal dysfunction. We know that autoimmune disease often begins in the gut. And so if we can treat the intestinal dysfunction with a group of things, including peptides, we know that we can get some benefit there. There's lots of animal research to support its use and a few human studies that are showing lots of promise.
Well, that's interesting. That's cool. So, along with that, then, I mean, it seems like it to some degree, like you said, they're out there, they're naturally recurring, they're available in lots of different forms. How does somebody know what they need and where the best place to get it from is? Is it a good idea to contact somebody like yourself in order to get that information, or how does that all work?
Yes. So ideally, you would work with a provider that knows how to use them. There's probably around 500 of us in the country that know how to use them well. Mostly are made by compounding pharmacies right now. There are a few that are made by pharmaceutical companies and available through your insurance, but most of them are only available through a compounding pharmacy and much like your bioidentical hormones, and a trained physician should be the one who helps you decide which route to go. So a lot of them are available only by injection, and they are once a week or every day or 5 days a week, depending on which one we're looking at.
Well, that's interesting. So typically this is the kind of thing I'm assuming that maybe, they get going on it, they basically would start and then eventually cut back on. Is that the kind of idea that most of the patients start out with a higher dosage to begin with, and then eventually over time you cut back as you no longer need as many? Is that
Exactly.
accurate?
So our bodies are depleted of many of these peptides as we age. And so that's part of the reason why a lot of autoimmune disease begins around the time of menopause, because as we age, we begin to we lose not only estrogen, testosterone, progesterone, growth hormone, thyroid hormone, we also begin to lose a lot of the peptides that are healing and involved in healing and repair and involved in managing your immune system so you're not throwing everything at making antibodies like you do in autoimmune disease. So if we can give ourselves those peptides that are no longer being actively made or in volume enough made by our bodies, then we can restore some of that more youthful function where you're not putting so much energy into making as in the case of autoimmune disease.
Okay, interesting. Cool. So basically, it's almost like you could view peptides as a form of a supplement to some degree, where you're basically just figuring out, okay, I'm deficient in whatever peptides or whatever it is that I need. And so, I'm going to be put these back into my body to help regenerate things, so to speak, I guess you could say.
Exactly. There's not really in the scientific settings, like in a research setting, there aren't really tests that are available for the general public to see what your levels are. People are deficient after the age of 40 or so will begin to decline in their optimal levels of these peptides.
Got it. And so people that have been diagnosed with an autoimmune disorder, typically they're going to be more deficient in peptides than somebody who, say, doesn't have an autoimmune condition. Would that be correct too, then?
Yes, we know from several of the studies that patients who have MS, for example, will have a lower level of a peptide from the thymus gland called thymophil-1. That's just in patients who have MS, have a lower level of that. And we can give them a replacement with an injection of this peptide, and they give it to themselves at home. It's easy to do. It's a tiny little insulin needle, and they can do really well. Most of the time, they get away with doing about twice a week. So much like bioidentical hormones, patients will ask me, okay, so how long do I have to be on this? And it's very individual dependent. Some patients can be off of it quickly. Some people, it takes a while. It all depends on what else is happening in your life. And also it depends on if this is something that's going to be a persistent thing for you in your life. So for example, menopause, you're going to want to continue treating that into your older age, as long as you want to feel that more youthful feeling.
Got it. Okay. So what about, let's say, somebody that's got either like Hashimoto's or Graves'? Are they going to want to continue taking those peptides forever, or what's usually your experience with something like that?
So what's interesting about it is I have had several patients who've been able to clear their Hashimoto or Graves. And we do that by working on the immune system with peptides, but we also do it based on their diet and their sleep and their stress and all the things that you've talked about on your previous episodes. I love the breath work. I think that's such a super helpful thing for many patients who have autoimmune things like Hashimoto. And many others, PTSD, diabetes even can be benefited by patients doing breath work. So I'm a big fan of that.
Yeah, for sure, absolutely. So if you're listening to this and haven't listened to some of the breathwork episodes, I've covered it a couple of times. So yeah, go back and check it out. But yeah, that's interesting. Yeah, about the peptides. So anything else that people should know about peptides that I didn't ask you? I mean, I'm sure obviously, tell us a little bit about the book that you've written and why you came out with that book, which I'm sure,
Sure.
there's a lot more information in the book that people can read.
Yeah. So it's called Counterclock, and it's an overview of peptides. It's written to a person. There are certainly more, we call them deeper dives, where you use information in a little block in each chapter. But there's a patient exhibit. Our patients from have, of course, their names so that they're to maintain their privacy. But there are patients at practice in that book, and each chapter is designed to be a standalone chapter. So if you have autoimmune problems, if you have cognitive or brain problems, each of those chapters is designed to be read by itself, but they build upon one another. And so it gives this sort of idea of how I think about treating patients all the way through. I usually will start with the intestines, I'll move on to the immune system, and then subsequent body systems based on how the patient's doing. So each chapter can be read by itself, and it's very accessible. Now, there also are some references to different journal articles. So in case you want to take this to your doctor and have them look at those references, this is an opportunity for all of us to learn more. You can also find a doctor in the back of the book. There are ways for you to find a doctor who does what I do that might be closer to you than Atlanta. And so it's a fairly comprehensive book, and it's written for the average person to read.
That's awesome. That's cool. Yeah, that's great. Yeah, like I said, I started reading it and I definitely noticed that it was, it was pretty easy to read. But I would imagine you've probably also written it for the benefit of a lot of the doctors out there that are really clueless about what peptides are and other healthcare providers to help educate them about, hey, this is an up and coming thing and something that you really should know a lot more about. And yeah, and then you just answered the other question I was going to ask is about, how does somebody find someone closer than, somebody in their area? Because I take it you don't really, well, I mean, you obviously can't actually give them to somebody virtually. Do you do any kind of like virtual consulting or anything like that, or is that not a part of your practice at this point?
Yes, we do virtual consulting, and we do. I'm licensed in Georgia, Florida, Alabama, and Tennessee, so we
Okay.
can do virtual consulting in those places. If you want to come to Atlanta for one visit, we can do a one in-person visit and then virtual consults every other time, all the other times. So that's also an option, and we have places for people to stay. If you come to our website, it's vinemedical.com. There are places for you to stay. There's things to do while you're in Atlanta visiting me if you wanted to come and do an in-person visit.
Awesome. That's cool. You probably have some people that have probably done that, I would imagine, just because of your
I
expertise in
do.
the field. Yeah. That's cool. That's awesome.
Mm-hmm.
Okay, so we will make sure that we are linking to your website, thebiomedical.com. We will include information on the book as well. I think, is the book actually out already or is it still in pre-launch?
It is out. It's on Amazon, both in a Kindle and a hard copy version. I'm working on the audiobook version, and I was surprised at how long it takes to do an audiobook.
I'm sure.
So
I'm sure that's a little bit of a challenge, but yeah, so we'll make sure that we link to on Amazon to the book as well so people can go grab the book. And anything else that I missed that you want to share with people?
I don't think so. I appreciate your time today. Thank you so much. You're a great interviewer.
Yeah, absolutely. It was great talking with you. And yeah, like I said, so if you are interested in more pet and learning more about peptides, especially check out her book. And then of course, her website as well. And thanks for listening. Stay tuned for another episode coming soon. And if you enjoyed this episode, please feel free and would greatly appreciate it if you would rate this podcast as well so that more people can find it.